Hi everyone, this is Dr. Ansari. I'm going to be talking to you about urinary tract infections today. There are a few different reasons why women tend to get urinary tract infections commonly. First of all is the anatomy, and I'm going to go through this now. On the top of the screen right now, you're going to see a little eye pop up. So you can always click on that and it'll connect you with an anatomy video that will go over the position of the urethra, which is the opening to the bladder, compared to where the vagina and the anus are located. So this is going to be important to review if you're not familiar with the way your organs are lined up in your body. So just review that anatomy video that you see popping up on the top of the screen. So anatomy. First of all, you should know that in women, our urethras are short, okay? And it's about 4 centimeters or about 2 inches, whereas a man's urethra is as long as his penis plus some, because then it goes even within the body a little bit longer. So that's why it's easy for bacteria to go through the urethra up to the bladder and infect us compared to men, because male urethras are so long that the bacteria usually doesn't even get there. In men, urinary tract infections are rare. There's also a genetic predisposition, meaning there's a genetic way that certain urethras are built. And this is on the cellular level pretty much, where maybe your mother or your sisters have recurrent urinary tract infections or frequent urinary tract infections. Maybe you've had them since you were a child and they've continued to occur into adulthood. It may be the way that your urethra was built. And there's nothing that you could usually see on an exam or with a cystoscopy, which is a bladder camera procedure where we can look inside the urethra and the bladder with a camera. Usually there's nothing to see. This is such a cellular level problem that there's nothing to do or nothing to be able to fix in order to prevent these urinary tract infections. So there is this genetic issue where people are just, born the way that they are born with, and it makes urinary tract infections more susceptible or more likely to occur. Another reason why urinary tract infections can occur commonly in women is because of intercourse or sex, okay? So think about, again, just reviewing your anatomy here, the urethra is located on top of the vaginal opening, okay? So this is your urethra, and this is your vaginal opening, and it's literally on top of each other. Very, just millimeters difference. So when you have sex and the penis is introduced into the vagina, sometimes that can also just seed or spread some bacteria towards the opening of the urethra. Remember that bacteria can actually move. They have a mechanism that allows them to almost like walk or be able to travel up. And there are other ways that it gets further up into the bladder, but it can then get into the bladder and then infect the area of the bladder and cause a urinary tract infection. So again, this is something called seeding. Okay. Anatomically, there's also some abnormalities that may occur, like a urethral diverticulum. And this is basically an outpouching of the urethra that causes urine to be collected. So if the urethra is just supposed to be like a solid tube, right? Here's the opening and then it goes into the bladder. A diverticulum is a little outpouching, a little sac that develops, and urine can collect in this area and become infected because it's not emptying properly. If this is truly becoming a problem and there are certain tests that the doctor does to be able to find this diverticulum, then it could be surgically repaired. Another reason for having urinary tract infections is maybe there are some folks who have difficulty urinating, or voiding is the medical term. So voiding issues. Okay, so they're not emptying their bladders completely, and then when you don't empty your bladder completely, that high level of urine that remains in the bladder can become infected. Another reason that urinary tract infections can occur is in some patients who have fecal incontinence, right? So usually the bacteria that infects the bladder are the same bacteria that are found in your stool. And so if you have more stool leaking out where it can smear up to the urethra, then yeah, it'll just seed that area, and then again the bacteria can enter the urethra and then go further up into the bladder. So fecal incontinence is another reason. Another really important reason for urinary tract infections may be someone who's entering the postmenopausal phase. Maybe you've had surgery and both of your ovaries were removed. That puts you into surgical menopause. Or you've entered menopause naturally and now you're postmenopausal, so you have low estrogen levels. Okay? This low estrogen state is really important because this is one of the reasons why urinary tract infections occur in older women who may have not had issues in the past. The lack of estrogen basically prevents the vagina from defending the urethra. That's one of the functions of estrogen and the vagina, is to defend the urethra. So the skin, with estrogen, the skin is thicker, it's bulkier, it's able to prevent things from entering the urethra. But after the estrogen is low, the vagina becomes thin and it becomes easier for the bacteria to enter. Estrogen is also really important for the urethra itself, so we don't understand everything about how estrogen affects the urethra itself, or that tube. Remember, the tube of the bladder is called the urethra, but there may be some function along that line as well, that the lack of estrogen is causing another level of dysfunction or lack of, or the urethra is not working the way that it should, and causing or becoming more susceptible to infections, or allowing more infections to enter. In the next video, we're going to talk about the definition of recurrent urinary tract infections and what's important in being able to recognize recurrent urinary tract infections, as well as treatments that one can do for urinary tract infections under the supervision of a physician.